Why do 50 million Americans not receive health care, and what can be done to reduce this number? Health care coverage is a mounting concern in the U.S., with many Americans not receiving needed care. 2012 marks the highest uninsured rate in American history, with 50.7 million without care. This is 16.7% of the entire U.S. population, according to the Census Bureau. The Patient Protection and Affordable Care Act of 2010 will bring reform to this unjust system. The issue of universal health care coverage has now come to the forefront of national contemplation and is being analyzed because of the complex components of this new legislation. Before 1920, the U.S. didn't have a regulated healthcare system. Since then, issues of accessing healthcare and affordability of care have blocked many Americans from getting the care they need and deserve. Americans have been forced to deal with commercial healthcare since 1940, when private insurance companies entered the market and raised rates, making a universally available healthcare system difficult to achieve. In 1965, President Johnson led the passing of Medicare and Medicaid legislation, thereby enhancing the Social Security Act of 1935. The system has changed little, leaving millions of deserving Americans without much-needed affordable care. The root of the entire issue is how can the U.S. government ensure that the average American receives quality health care. President Obama, along with mainly congressional Democrats, pushed through a bill that will drastically change the healthcare system in the U.S. This Patient Protection and Affordable Care Act will provide health care to roughly 30 million Americans, lower the cost of health care, and make it easier for individuals and small businesses to obtain health care plans. The law passed, but is being scrutinized in the Supreme Court, which is currently ruling over its constitutionality. If the bill is declared unconstitutional, then it would likely be revised in Congress in an attempt to gain more bipartisan support. On a national level, there is a growing debate about which parts of the law will be upheld by the court. The act has thus become a major political issue leading into the 2012 elections. The battle over this legislation has been raging since 2009 and will likely last another couple of months, with the Supreme Court deciding the outcome. Obama signed the act in 2010, with most of the reforms taking place by 2014. This new law provides important economic, political, and sociological benefits nationally. It is a necessary solution to a problem that has plagued American healthcare. Despite the Patient Protection and Affordable Care Act expanding coverage to 30 million Americans, there will still be approximately 23 million uninsured. The uninsured will consist of undocumented immigrants, those uninsured for 3 months or less, and those for whom insurance costs would be less than 8% of their income. The projected 30 million newly insured will receive coverage from an expanded Medicaid program, which will cover all families with incomes below 133% of the federal poverty level, putting an end to the conceptual distinctions between the deserving and undeserving poor. The new policy will also put in place safeguards preventing insurance companies from denying protection or cutting off much-needed benefits. Incoming healthcare reforms will enable many Americans to gain better access to other necessities like food, water, shelter, jobs, and basic education. Currently, people are devoting their incomes to ridiculously high healthcare rates when they also need to be providing their families with essentials to subsist. The government and the people have made it a priority to provide food stamps and universal public education, so something as important as general health care should also be instituted without hesitation. Expanded health care will save lives and improve the quality of life. Expanded health care coverage will also carry large dividends for the demographic complexion of America. Many of the uninsured are minorities, creating a gap between races in the U.S. of those with and without care. With the new health programs put into place, discrepancies may be leveled, giving those disadvantaged more opportunities. The economy over the next 20 years will be greatly improved by the new healthcare reform system. America's gross domestic product will be improved by over 2% by 2020 and 8% by 2030. The net income for the average American will rise because of reduced healthcare costs and reduced taxes. By 2019, it is projected that these medical costs will decline by $100 billion. essentially by slowing and reducing healthcare gross costs. The standard of living will improve along with the gross domestic product. By expanding coverage to approximately 30 million Americans who currently do not receive any coverage, unemployment rates will decrease because of a buildup of inflation. With reform and the expansive coverage, the labor supply will increase as there will now be better health benefits for the average worker. Some stress that the policies would hurt the welfare of many individuals, but in reality it will positively influence countless Americans without care, as well as attempt to revitalize the U.S. economy. For the Patient Protection and Affordable Care Act to be successful, medical costs must decline in the long term, and with a more modern approach to delivery of services, the healthcare system will become more efficient, effective, and less expensive. Changes in the packaging of medical services into larger payment groups, utilizing value-based purchasing and advanced care coordination would stimulate the productivity of healthcare and would also improve the quality of care. Healthcare reforms will invariably increase national GDP, create a faster and more effective care system, cut unemployment rates, reduce the national deficit in the long term, increase average income, and better the standard of living. With all the benefits to be gained by this law, it is evident that the U.S. would prosper under such a system. The main political influence in this health debate will be the judicial rulings of the Supreme Court, which will decide the fate of certain acts in the law. If the law isn't deemed constitutional by the Supreme Court, it would undermine the U.S. Constitution in that Article 1, Section 8 states Congress's power to lay and collect taxes to provide for the general welfare of the United States, and also that it may regulate foreign and interstate trade. In one recent court case in Florida, it was decided that Congress could enforce its taxing powers and policy judgments in the healthcare debate due to elements in the Constitution. Already, much controversy over state rulings has made issues within the law take a national precedence in the Supreme Court. Conservatives claim that new laws in the Patient Protection and Affordable Care Act would unfairly tax individuals, and the Constitution does not specifically address measures to penalize Americans who refuse to participate in any singular aspect of commerce. Progressives counter this with an argument claiming that an individual state such mandates are supported by the 10th Amendment and its general prohibition of the federal government from enacting powers not specifically granted to it by the states. Obama's health plan calls for an increased tax on some individuals. Conservatives have condemned progressives for this, but even if the taxes of a few wealthy are being raised, the plan will aid millions of Americans. Opposition to the law also claims that the role of government is being drastically expanded, while really it has already been administering Medicare and Medicaid programs for a large segment of America for nearly 50 years. The government hasn't completely taken over control of healthcare. Simply, private insurance companies have been limited in terms of their ability to deny coverage. With the political, economic, and sociological benefits that it will implement, the Patient Protection and Affordable Care Act will be a success on a national scale. The decision in the U.S. Supreme Court must be to declare the PPACA constitutional. Such a decision would reflect the right of Congress by the Constitution to make such legislation and deliver justice to those many millions of Americans who don't receive coverage. The U.S. is currently behind most of the developed world in terms of health services, due to the fact that much of Western Europe has already implemented universal health care. This law will provide the U.S. with a chance to join the ranks of the world's elite and better the lives of millions.